for people who have been traumatized by a narcissist, what normally goes wrong for them in therapy? They go to a therapist. Where are the pain points for them? Where are they being failed either by the therapist or by, I don't know what, but what do you think?
This is a big one. I'm really passionate about this one. So they get invalidated sometimes inadvertently by a therapist because there is it has to do with the ethics of licensed professionals. Licensed professionals are not permitted to diagnose somebody who's not in the room. So if somebody comes in and describes a narcissist, ethically speaking, sometimes legally speaking, a therapist can't say, you just described someone who meets the criteria for, because you're not treating that person. So now you're mislabeling somebody, and that's actually defamation of character and all kinds of other things, even if it's accurate. So what therapists have been trained to do is redirect the problems back onto the identified patient, who is the person in the room. And these types of ethical guidelines and rules changed within different jurisdictions, different states, different countries, etc. What therapists have not been taught to do, which I believe is totally appropriate, is to draw conclusions based on enduring patterns. So you can do that, and you don't necessarily have to officially diagnose somebody who's not in the room, but you can draw conclusions based on consistent, persistent, pervasive behavior. But ultimately what happens is the patient who's in therapy, the responsibility for change kind of just falls into their lap with most therapists. And so the therapist is going to look for a reason why they got themselves in this situation. What did you do to draw this person into your life, into your orbit? Why didn't you just leave? What in your childhood made you more susceptible to falling prey to this abusive person? And those are really problematic questions to ask because, and I said this in a recent my post yesterday, based on survey data from survivors of narcissistic abuse, over 70% of individuals who have gone to a therapist and tried to figure out how to get out of an abusive relationship with a narcissist do not have any history of and do not identify as like a codependent person, somebody who has low self-esteem, somebody who has poor boundaries. Only in the context of this narcissistic relationship is where these features started to come out as a reaction to the abuse, not because it's inherent in them. And so, long story short, therapists will take their theory bias and say there has to have been some reason why you got yourself into this mess, and we need to get you out of it. So you need to work on your codependency. We need to work on your insecure attachment. We need to work on, your picker. You have a bad dating picker. And so they basically leave feeling invalidated, like they're responsible to repair the relationship, and there's something wrong with them that's going to continue to, they're going to continue finding themselves in these bad situations if they don't work on their stuff, their baggage.
Okay. There's a lot to unpack there. So is a therapist allowed to say your partner sounds narcissistic?
Not really.
Okay. And to me, that's a major problem. If you can't say what something sounds like, and you're forced to put it on the patient, I don't even know if I can blame the therapist as much as I would the system that forces them to not say what's going on.
Right. Yeah, it needs reform. I'll tell you that.
Okay. And there's much more to go over what you just said too. So I think there's healing stages, right? And when they skip the stages of validation, this is what was going on, you were being abused by a narcissist and all that kind of good stuff, that's a massive thing to skip, because when you don't give them that, now you're just slapping them in the face. You don't go straight to working on your side of the street. And I don't know if I differ with you on this. Maybe I do, maybe I don't. But eventually, I do think part of the healing is looking at your side of the street and looking at, okay, where did I disrespect myself, or where maybe were my boundaries weaker than they could have been, or maybe I did end up having a lower sense of self-worth eventually. And this is one thing you've done for me as someone who's helped, like doing what you do. It's forced me to get really clear on like the ins and outs of what I believe and how I help people myself. Because I think I might have been more rough around the edges, but you forced me to really get clear. And for good reason, because there were people that used to say to me, stop saying codependent because it's shaming to the people that have been in that situation. And I didn't like it at first, but eventually I said, okay, I can see what you're saying. But do you think there's a point where, they have to work on the things I had said? And not to blame them though, but just because why not?
I agree. I think everybody can work on enhancing the inherent traits that they have to help them become more resilient and resistant to falling, to accepting someone like that in their life, if that makes sense. So if you have a healthy degree of agreeableness, let's say, or cooperation in your trait profile, and that has allowed you to accept a beating that you shouldn't take, then yes, you absolutely need to prepare for, how to keep yourself from it just quickly accepting someone else like that in your life again. I wouldn't pathologize the victim though and say there's something wrong. I would just have to give them an education and say there are people who are not wired the same way. And if you continue to just accept that everyone is built the same, you're probably going to get victimized again. So you need to not necessarily change who you are. You just need to change, a little bit of how you perceive everybody as being the same on the inside, because it's just not true that everybody's the same on the inside.
Okay. And that's a very good distinction, because I think the crux of what I do, trying to help people practice radical self-respect.
Yeah.
I think I talk about the toxic behaviors because it is something that people have experience with, and they're the situations that people would need to learn. Okay, this is disrespect. This is abuse. What do I do in that situation? And I think what you've helped me to do is emphasize more. It isn't your fault. Like sometimes they are just sneaky and tricky. And when you don't realize what's going on, you don't even realize you're disrespecting yourself, because you're in the relationship and you're in it. You're that frog in the boiling pot. Exactly. But once you're out, then you can work on those things. And I think it's not to say there's something wrong with you, but I think there's room for everyone to improve.
I agree. 100%.
Okay. So I think, so we're definitely on the same page with all of that then. And I think people still use the word codependency, but considering what you've said, I've tried not to use it. Dr. George Simon said the same thing to me about a year ago. So I decided to drop it. Do you think in some cases they are dependent?
Absolutely.
Okay.
But I do think that lots of people who enter into a relationship with the intention to be interdependent or mutually dependent, which is not unhealthy, that's just an attachment, become dependent if they've been coerced and manipulated enough. They start to become dependent in ways that aren't pervasive across their life. So in other areas, they're still very autonomous. It's only in the context of this toxic relationship that they become dependent. And that's sort of a learned behavior. That's not an inherent trait. So eliminate the relationship that's toxic, and then the autonomy can be restored. Then there is this cluster C thing that lots of people don't even know exists. And there is such a thing as a dependent personality, which is for lack of, no point in being politically correct now. It's a disordered way of being. It's not creating havoc in the lives of people the way narcissism is, but dependent personality disorder is a real disorder. And people who are dependent are very, very susceptible to being the prey of a psychopath or a narcissist, because they literally depend on somebody else to make almost every decision for them. That's part of the disorder in their personality. So those pairings are very common, but dependent personality disorder is not nearly as prevalent as people who are being accused of being codependent is.
Okay, that makes perfect sense to me. And I think the dependent folks with a narcissist, they probably fit together like puzzle pieces
Oh, yeah.
in a bad way.
Very bad way.
Yeah. So I think that does clear up a lot of stuff there as well.